Says you're live on
Good afternoon. Yeah, I think we're live now. Good afternoon, everyone. Welcome to Laugh Facebook Live. I'm Sophia Towns. I'm the program coordinator for the Low Country Autism Foundation. And today we are going to discuss everything dealing with ABA therapy. So all about ABA. And joining us today is our program manager, Dr. Stacy Litton. And she is also a BCBAD, and she is going to basically educate us more on ABA. So, Stacy, why don't you go ahead and take the wheel?
Okay. Hi, everybody. So like Sophia said, my name is Stacy Litton, and I work for LAUGH, and I've also been a board certified behavior analyst for about 11 years. Just to help a little bit with the acronyms, I know in special education there are so many acronyms, and in the world of applied behavior analysis, that is no different. So ABA stands for Applied Behavior Analysis, and it is a science. It's not one intervention. It's a science based on learning and behavior. So there are a lot of therapies that are based on this science that are utilized when working with children and adults with autism spectrum disorder. So like Sophia said too, I'm a BCBAD, which is a doctorate level board certified behavior analyst. And any of you who are receiving ABA services might be working with the BCBAD. You might be working with a BCBA, which is a board certified behavior analyst. And the difference in those is that for the doctorate part, you have to have a PhD or an EDD, and you need to have either done some studies that are behavior analytic in nature, or you need to have done some type of postdoctoral fellowship in applied behavior analysis. And a BCBA has to have a master's degree, and they have to do a certain number of hours of supervision. And then there's also a board certified assistant behavior analysis who you might be working with. And that person has to have an undergraduate degree, pass the test, and have a certain number of hours, but they don't have to have a master's degree. And then there's also a registered behavior technician, which is somebody who might be coming into your home more frequently and working with individuals. Usually the BCBA or the BCBA ABA, they will come in and do consultations and help create the programming. And the RBT is usually the person who's coming in on a daily basis. So I kind of just wanted to provide a little bit of information about that because there's a lot of acronyms. And I think a lot to cover when it comes to that. So are there any specific questions you want me to answer, Sophia?
Yeah, I think let's just start off by defining ABA. What is ABA therapy? I've been getting a lot of new diagnoses over the last few days, and that's one of the first questions. The individual receives a diagnosis of autism, and then the parents or caregivers want to seek out ABA therapy. So would you mind explaining what ABA therapy is exactly?
Sure. So ABA therapy is based on the science of learning and behavior. So ABA is a science. ABA would be an umbrella term with all of these different interventions that fall underneath it. And so behavior analysis, it helps us to understand how behavior works, how learning takes place. It helps us understand how behavior is impacted by the environment. So it's really giving us a lot of information in order to be able to work on skills like language and communication, attention, focus, memory, skill acquisition for academics, and also decreasing problem behavior. So we're trying to determine how we can increase the skills and decrease the problem behaviors to make learning take place.
Awesome. Sorry for the cat.
No, I mean, cats need to learn too.
Sorry. Awesome. So how do families see ABA implemented for individuals with ASD?
Okay, so when someone tells you that you need to seek out ABA services, so you might receive your diagnosis and they say, okay, let's get you a speech and language pathologist, let's get occupational therapy, and let's get applied behavior analysis. The reason that you're going to want to utilize a company that specializes in applied behavior analysis is that you can really start working on those skills that are going to increase your quality of life. So you want to be able to communicate. You want somebody to be able to know your wants, your needs, how you're feeling. You want to know the academic aspects. They can work on word recognition. You want to decrease those problem behaviors, because if you have a really high rate of problem behavior, then you're not open to learning. And so if you're not open to learning, then you're not going to be able to increase your ability to express your wants and needs, and to learn new skills that are going to increase your independence and quality of life. So that's what you can really focus on with an ABA company, is really just increasing your skills and decreasing any behaviors that are going to impede your learning in any way. So that's why it's really so important, is because a lot of kids are diagnosed because they have a deficit in communication,
Right.
social skills. They have a lot of restrictive and repetitive behaviors. And although these restrictive and repetitive behaviors can serve a purpose, a lot of times they also interfere with learning. So we have to be able to have a balance between, meeting your sensory needs and also making you available to learn, so that you can communicate and you can let people know what you need, who you are, and that you can really be yourself.
Awesome. Absolutely. Absolutely. That's awesome. Why is ABA important for individuals with ASD? Why is it important?
Well, ABA and interventions based on the science of ABA are the gold standard for intervention for individuals with autism. So there are decades of studies that show the benefits of implementing procedures based on the science of applied behavior analysis. And it's not only for individuals with autism. I mean, we see applied behavior analysis in the world around us all the time. So when someone talks to you about ABA, you might be thinking, okay, this is something that's just for individuals with ASD. Not true. I mean, just to give you a couple of examples, when you get in your car and if you don't put your seatbelt on, what happens? What do you
Uh,
hear?
bing, bing,
Yep,
bing,
it
bing.
starts beeping at you. And it's
Yeah.
like, put your seatbelt on. And the reason that that's there is because you're going to put your seatbelt on to make that dinging go away. And
Right.
that is called negative reinforcement. And that is a principle of applied behavior analysis. So you're more likely to put your seatbelt on to make that dinging go away. So they're using the principles of applied behavior analysis to keep people safe. Another example of this might be your kids. So I have two kids, and my son loved his pacifier growing up. And I always said, I was like, I'm not going to give my kids pacifier. Oh, I gave that child his pacifier because I was being reinforced when I gave it to him because his crying went away. And he was
Right.
being reinforced because he got his pacifier. So he was crying in order to get it. And I gave it to him in order to make the crying go away. And those are both principles of applied behavior analysis. So we can just look at the things that take place every day and see how the science of applied behavior analysis is working. And those are the same principles that we use to teach new skills. So I might teach him to say, "Passy, please," instead of crying, if he's old enough to learn that. And so
Ah,
you're going to teach a different skill that replaces that problem behavior. So it's all about learning, and it's about adjusting the environment in order to really increase skills and decrease those behaviors that are going to interfere with learning and socialization.
that's a great point. That's a really good point. Um, is ABA useful? Is it really only useful for people that are diagnosed with autism? Or can ABA be used in other situations, diagnoses?
Oh, I think ABA is for everybody. And my husband will be the first to
Everybody.
tell you that
Okay.
I use the principles of ABA on him all the time. So, yes, yes. Because I mean, really, if you look at reinforcement and you look at punishment and you look how that changes behavior. So I'll give you an example with my husband. He actually changed my behavior. When we first started dating, we would talk to each other. And if we got in an argument, I would stomp out of the room and sit in the other room and wait for him to come in the room because previously that behavior had been reinforced. If I went to another room and sat there and pouted, someone would come in and ask me what was wrong. He did not do that. So
Ooh.
my behavior of stomping out of the room was no longer being reinforced. He was actually being reinforced because I left him alone. And that's what he wanted. So he was being reinforced by being left alone. And my behavior was being put on extinction because I was no longer getting reinforced for walking out. So that changed my behavior. Then when we got in fights, I would stay in the room and talk until we came to a resolution. So by him no longer reinforcing my behavior, it caused my behavior to change. And then by me staying in the room, it actually caused his behavior to change because then he would have a quick conversation with me so that he could move on and no longer have to talk to me about it. So those are the principles of applied behavior analysis working in an everyday environment. And so that is what someone's doing when they're working with a child with ASD. It just looks a little bit different because the way that my learning might take place might be different than the way that their learning is going to take place. And I think
Mhm.
that's something important to remember when you're seeing someone work with your child. ABA is not just discrete trial. And that's an intervention that a lot of people see used where you're sitting at the table and I'm asking you something and you're responding, and I'm asking you something and you're responding. And that can be a great way to learn when you're learning some basic skills.
Mhm.
But there are a lot of other interventions that fall under that umbrella of applied behavior analysis. And if you're not happy with what you're seeing and the way the learning is taking place, have that conversation with the person who's working with you and your family. Because, and ask questions. Why are you doing that? Why is this
Mhm.
helpful? How is this
Mhm.
addressing the skills that I'm really interested in?
Mhm.
Because that's the main reason that they're there, is to help you, your family, and your child. And so if
Mhm.
you're not confident in what's taking place, ask questions about
Mhm.
why they're doing it and what the outcomes are.
Mhm. That's a really good point. I was going to ask you, what do you do if a parent says, "Hey, I'm not happy. I'm seeing some things I'm not sure about, and it's ABA, but I don't know if it's okay or not." So the parent should be asking questions. Why are you doing this? What is the purpose? Um, what behavior are you trying to extinguish? Um, yeah, that's a good point. Um, what what do you think? What should a family look for when they receive their autism diagnosis and then they're looking for an ABA provider?
Mhm.
Um, what should the family be looking for in an ABA provider?
Okay. I think one of the main things that you're looking for is making sure that they have qualified individuals who are working for the company.
Mhm.
So making sure that there is a qualified board certified behavior analyst on staff, a BCBA,
Mhm.
making sure that the person who's working with your child on a daily basis, whether it's in a home, in a clinic, in a community, make sure that they have the appropriate training. If they're a registered behavior technician, that is really what you want, because they at least have that minimal amount of 40 hours of training in order to make sure they're understanding the principles of behavior and what they're supposed to be implementing to help with behavior change. I would also say make sure the company you're working with collects data. That is one of
Mhm.
the main things. Is you don't know if something's working if you don't have any data. There's no way to know, because you could say, I don't really think this is working, or I definitely think this is working. And then if you go look at the data, it might tell you something completely different. So the numbers don't lie. So make sure that they're collecting data and that they have a clear baseline, which means they know where they're starting and they know
Mhm.
where they're trying to go. And then I would also say, make sure that they're asking you what's important. What's important to you? What skills are important to you? What do you want your child to learn? And then also make sure they have a really good assessment that they're working from. So they should be assessing the skills to see where they're starting. And then from the information from the assessment and from the information from talking to you, they're going to work with you to make a determination about what skills you want to start working on. So that social validity piece, making sure that you are really focusing on skills that are important to the individual themselves and to the family. So I would say
Mhm.
those are the top things to look for when you're looking for a really good ABA provider.
Okay. All right.
Oh,
That.
sorry, evidence-based practices.
Oh, go ahead.
Make sure
Yes.
they're
Yes.
using evidence-based practices. That's in
Can
that
you
there are
elaborate on that?
Yes, there are currently 27 evidence-based practices. You can find those listed on the National Professional Development for Autism Spectrum Disorder website. So
Mhm.
there are 27 evidence-based practices. They should not be using all 27. They should only be using the ones that are appropriate for the skills they're working on. There's a nice chart there at that website that shows you these are the 27 evidence-based practices. These are the ages that these evidence-based practices are appropriate for, and these are the skills. So communication or social skills or behavior reduction. So make sure that they are knowledgeable about evidence-based practices as well, so that you know that what they're implementing will work.
Mhm. Okay. All right. So really it comes down to making sure that your provider is quality, that they are, if it's not a BCBA or BCBAD who is, most of the time being with your child administering the therapy, we need to make sure that it is an RBT, a
Mhm.
registered behavioral technician. And the provider should be able to show proof of that so
Yes.
that we know that they are paired with someone who is educated in behavior.
Yes. And when the BCBA or the supervisor is coming in the home, they're
Mhm,
supposed to be there to provide feedback for the family,
mhm.
also to check on the programming, make sure the programming is effective. And they're supposed to be looking at those data frequently to make sure, okay, yeah, we're moving in the right direction. Or, you know what, we're not moving in the right direction with this program. Let's look at something else because not everything works. That's just the way it
Right.
is. Like I could be the best BCBA in the universe. And you know what? Sometimes what I choose to implement doesn't work. And the important thing about knowing you have a good provider is that they're checking the data and they're saying, you know what? I'm noticing this isn't working. Let's try something different. So
Mhm.
they're noticing when something's not effective and they're making those changes to make sure you continue to make progress. Because when you kind of see a stall and you're not making progress and
Right.
nobody's addressing it, that's when it becomes a problem.
Okay. Okay. So at what point at what point do you say something to the powers that be? I guess at what point, if you yourself you're not seeing a change in behavior, is that, are there any red flags you would say families need to be aware of?
I mean, I would say really anytime you have a question, ask.
Mhm.
Because I know that from, I don't currently I work mainly in schools now, but going into homes, I did that for many years.
Mhm.
And I found that most problems started because people didn't ask me questions that they had. And I didn't give them the information because sometimes I didn't know they wanted it. Sometimes I didn't
Right.
know they had a question about it. Sometimes I didn't know. And so if as the provider, if I don't know, then I can't give you that information that you need. So I would say anytime you have a question, don't be afraid to ask it because this is your family. This is the outcomes for your child. That is what is most important. And so no matter what your question is, at any time ask it. Don't wait. Don't wait.
Yeah.
Because there's no hurt and there's no harm in asking. What are you doing? What
Yeah.
intervention is that? How
Right.
do you do that? Why did you do this? Or Why didn't you do it this way? Or what are you really working on? What is the outcome? Why are we doing this? If you don't know
Mhm.
the answers to those, ask. There's I would say with 1000% certainty, they would rather you ask than sit there and say, "What is happening?" and start to get upset.
Mhm.
Definitely always ask.
Okay. Okay.
Definitely.
Um, it actually, I just thought of something. Parent training. I know that for those of you that don't know, I have three boys, and two of them have autism, and both of them um, do have ABA therapy. So I was over at the clinic getting some parent training last week, and so definitely at some point, I would think everyone at some point in the child's plan of care, at some point, all parents should be brought in, or either the BCBA comes into the home for parent training, correct?
Absolutely. I mean, parent training is really essential because you're the one who's with your child the most. You know them the best. And so knowing how to implement these procedures, you're the one who's going to be able to generalize these skills, because they might be working on them in the clinic with one specific person, but it's very difficult sometimes for kids with ASD to then do that same skill in a different environment with a different person. So they might be able to do something at school with the teacher, but then when it comes to come home, they might not be able to do that same skill at home with the parent. So the parent knowing how to implement these procedures, knowing and having an understanding of what's taking place is going to just help even more, because then you're going to be able to implement those procedures at home, and you're going to know how to react. Maybe if a problem behavior pops up at home that has been worked on in the clinic, or in the community. So having that knowledge is absolutely going to help.
Right, right. And so it's really important as a parent to be very involved with the ABA therapy,
Yes.
knowing what's going on. I do know, I have heard before, moms get tired. I get it. I get it. And, you drop the kid off at ABA for a few hours, you pick up, and then you move on with your day.
Hmm.
And I have run into some parents before. It's basically treated as babysitting.
Right.
Um, there's no carryover at home.
Right.
Would you mind addressing that? Just the importance of carryover at home, and probably also in other therapies, such as speech therapy, trying to get the development of that language.
Hmm.
Um,
Hmm. Yeah, absolutely. I mean, there are some companies. One of the companies I used to work for when I was in California, and another actually that I worked for in New Jersey, they required a certain amount of parent involvement, or the services were no longer provided. And that, I think, speaks to how important parent participation is, because if I am with your child 3 hours a day, 5 days a week, that's 15 hours, but you're with them the rest of the time, or they're at school. And so you having an understanding of what's taking place is the only way that you're going to have a really big impact on the skill acquisition of that child. It's essential. And I do understand that getting exhausted. I mean, you know, especially now that a lot of kids have been home a lot more and parents are trying to work while their kids are at home. I mean, I had an extremely elaborate reinforcement system set up for my son during COVID. And I think we both might have killed each other if that had not been set up, but I also have a lot of training in that. And
yeah.
so I think that other people being able to get that training so that they feel really competent in being able to handle situations that come up, that also decreases the anxiety and the frustration and sometimes the depression, because you feel like you have the skills to be able to handle the situations that come up. Do you still falter? Do you still fall on your face sometimes? Yes. Do I still go to sleep sometimes being like, what did I do? Why did I decide to react that way? Yes.
Yeah.
um, we all do that, no matter how much training you have. But knowledge is power, and the more knowledge you have, the more adept you're going to be at being able to address the behaviors and also work on those skills of communication and social skills and all the things. It's gonna empower you as a parent, and it is essential to success.
I mean, just speaking from my personal experience with both of my boys, especially with my older son who has autism, ABA has changed our lives for the good, for the better. And I mean, I really, ABA, my son was nonverbal until the age of 5. I cannot say enough positive uh, things about ABA. I mean, thank God for it, because he can talk, he can tell us his wants and needs, and just, man, it's a good thing. It's a good thing. So I think that's all the time we have. So
Okay.
yeah, thank you so much. That was so just empowering, and just so much great knowledge. Thank you so much
Well, thanks for
for
having me,
doing this.
Sophia.
Yes, absolutely. And everyone, if you guys have any questions, post them in the comments. We'll get them answered. I'll be taking a look at those, and stay tuned for our next Facebook Live. Have a great afternoon, y'all.
Bye,
Bye-bye.
everybody.